the morning. See, you gotta get them to buy a blood pressure cuff if they don't already have it, and acquire more data. If they're good when they first get up and they empty their bladder and they go start the coffee pot, but 2 o'clock in the afternoon it's 168 over 102. Think weight bearing, you think spine. They're sitting there against the force of gravity, compressing on their discs. It's starting to touch the nerves that supply the ticker, and the blood pressure goes up. I'm thinking spinal care for this one. I try that for a while, but if it doesn't respond, if they're having chest pain, pain over the very edge of the eyebrow, throat constriction, that's all obvious stuff. Enter shoulder pain, tingling in the jaw, that's all red flag to me. Port Huron McLaren is like half a mile down the road, Mrs. Jones, go over there. But a lot of times they'll just have pain behind their collarbones. They'll have some left thenar pain, pain under the costal arch, pain under the umbilicus that radiates into the low back. Poke on their belly there. If it's sore, I got this weird pain. When I hear this, I got this weird pain, doc, that's when my antenna go up. I got this weird thing. It starts off here and it goes in my back. I'm taking that Mrs. Scribumple's blood pressure. You never know. Might be that. Nutritional strategies for this patient with mild to moderate blood pressure. You can help them. If it's mild to moderate, a lot of times they come in, they already know they have blood pressure. They're on blood pressure meds, right? I want to be off of these pills. Got anything? Is there anything we can try? Yep, you do now. Cataplex E2. Cataplex E2 is a fancy schmancy fraction of the vitamin E2 molecule that when it gets into the bloodstream, grabs calcium and pulls it into the arterial wall, relaxing the smooth muscle in the arterial wall. Blood pressure drops. That's the guy that scared the crap out of me. That wouldn't go to the doctor, wouldn't go to the ER. I had him, and his blood pressure was 200 and something over 100. Scared the tar right out of me. I had him, I opened up, when I got a bottle of Cataplex E2, I dumped like a handful, it must have been 6 or 7 of them. Pop these in your mouth, Mr. Jones, start chewing on them. Go sit out in my reception room, I'm seeing the next patient. Keep chewing on them, don't swallow it. Don't swallow it. Just keep that paste in your mouth. I'll get back to get you after the next patient. And I saw my next patient, I'm trying to concentrate on the patient going, is this guy gonna stroke in my office? Is he gonna have a heart attack? Please, God. That's when you beg, please, God, not now. So I pulled him back into the room after sucking on that E2 for 10 minutes, and his blood pressure was now like 150 over 80. It's like, it was stunning how much that blood pressure dropped in how quick a time. I don't know if he ever did follow up with his doctor. I don't know if he's still here or not. I don't even know. He left, never came back. But E2, when you're concerned and you're like having a crisis moment, that E2 is think of it as nitro. Nitroglycerin works very much like it. Okay? Okay. Also, other products to consider for mild to moderate blood pressure, and your patient wants to get off a blood pressure med. Dan Shen. Red Sage. It's from Supreme Nutrition Products. That's a beautiful little plant. Beautiful little product. Used for all kinds of cardiovascular issues because it works on multiple pathways.
Can you say that again?
Dan Shen.
Spell it.
D-A-N space S-H-E-N. Dan Shen.
And who made it?
That is from Supreme Nutrition Products. Dr. Leibowitz, I believe, owns that company. He's an AK guy, used to practice in Colorado. I think he's out in Hawaii now. But I've used that one because it's your broad-based nutritional product for the heart. So you're covering a lot of bases, especially when you're not exactly sure what's going on with their ticker, but they want to change and try something up. I'll put them on Dan Shen. It's just red sage. Been used for 5,000 years in healing. It's a great little product. Yes.
Oh, it is?
I don't know that I've ever used it for that. The question was, have you ever used it for hemorrhoids? And does it work well? And the answer is, I don't know. Okay. 2 tablets 3 times a day for the E2. Same thing for the Dan Shen. This is really, you'll see this more often than you'll see high blood pressure if you're willing to take some blood pressures in your office. These are the people I refer to as the walking dead. BP is too low. Anytime that systolic blood pressure below 105, that's diagnostic. That's diagnostic of a thiamine deficiency, vitamin B1. And so, because 15% of the population cannot phosphorylate their B vitamins correctly, which means when you take your B complex and you don't feel any improvement in energy, and I hear that all the time from my patients, I took some B before, doc, it didn't do anything. 15% of the population cannot phosphorylate their B complex correctly in the liver. And so it doesn't matter how many B complex you eat, you're just pooping them out, right? I give them Bio-3-BG, that's from Biotics. It is a phosphorylated B complex. It already has the phosphorus minerals attached to the B complex, making it biologically active. You take it into the bloodstream and it immediately starts going to the cells. It does not have to go to the liver. It does not need to be phosphorylated. You bypass that completely. You give it to them, it goes into the blood, it goes into the cells, and their energy comes up. That's how you fix a tired heart, too. Poor oxygenation. It's because their heart's not pushing enough blood. When you've got a low blood pressure like that, that's why I say to them, you feel like the walking dead, oh my God. I hear that all the time, oh my God, the walking dead. Vascular is also very useful. That's a product from Standard Process that helps to alleviate this. But patients with low blood pressure, those are the ones who come in regularly. They're sick and sore all the days of their life. They just hurt. But low blood pressure doesn't kill you. But some days you wish you were dead. You're so tired. Right? You're walking dead. Yes?
Oftentimes people are on blood pressure meds and meds are putting people with
So the question is, what do you do if the patient's on BP meds and the BP meds are dropping the blood pressure too low, right? That happens all the time. I'm giving him that Bio-3-BG, and I'm giving him a lot. I'm giving him 2 per waking hour. I want to bring them back from the dead, and I want to bring them back in a hurry. And I observe that blood pressure. I stay on top of those cases closely. Every 3 to 4 days, Mrs. Goldfarb-Vinovisky, please come in the office. I want to check your blood pressure. And I've got a guy in the practice right now, 34 years old, 6'2", 180 pounds. He looks like he's ready to compete in all kinds of sports. He's the walking dead. He's 6'2", 185, 190 pounds. His blood pressure is 92. 92 over nothing. 92 over nothing. He's depressed, anxious.
Go figure.
Mom's concerned, he's suicidal. 92 over nothing. That's what his blood pressure was. So I put him on these 3 BGs, 2 per waking hour. That's a lot of pills. Of course, Mr. Jones. You want to come back from the walking dead soon or later? You pick. I want it sooner rather than later. I don't want you going back to the light too soon. Right? You talk to me about that a little bit. So you have goals, you have lessons, you have reasons to be here. You're not ready to go back. You're going to fix your blood pressure first. So he came in for his follow-up 10 days later. He went from 92 to nothing to 102 over almost nothing. I think it was like 68 or something like that. But for a guy who's 6'2", 190 pounds, that's still way too low. How's your energy, I asked him. When you get an you're not there, right? Mr. Jones, keep eating those B complex. Bio-3-BGs, 2 per waking hour. It's a lot of 2 per waking hour, please. I'll see you in 10 days. But he's eating now. He's a little less anxious. He's working out again. He's starting to come back from the dead. Fixing a thiamine. This is Harry talked about this. Harry out here talked about this. Fixing a thiamine deficiency can take time. Not like my last patient who who I found this problem in. My 52-year-old female who married the man she thought she could work with.
Oh.
Turned out he wasn't the guy. So she was stressed out and exhausted and frustrated all the time. And after 3 or 4 visits of fixing her neck and her low back stuff, she's like, have you done anything for fatigue? And I get talking to her about this situation. Oh my God, my husband is making me nuts. I wish I had a buck for every time I heard my wife say that. But I checked her blood pressure, and sure enough, she was 90-something over nothing again. Said 2 per waking hour. That's a lot of pills. Yes, ma'am. 2 per waking hour. I want to get you back as quickly as possible. For her, it was 3 days. 3 days what brought her back from the dead. And she found out the hard way. At 3 o'clock in the morning, she's out there in the front room vacuuming the carpet. I think I decided to cut back at that point, Doc. Good call, good call. Expected to take a while, but sometimes it's fast. That 3BG, it's like the single biggest, like literally the only B complex I hand out in the office, because I want to skip that whole phosphorylation issue. You have a question? Yes?
Would the adrenals be involved in this?
Oh, yes. Yes, their adrenals are always in the trash can. But one of the single biggest thing those adrenals need are B complex, right? And thiamine in particular. So in addition to screening for things like cytothyamine, I'll get to the adrenals thing. That is in here. We'll talk about that a little bit. But yes, adrenals are involved, yes.
Have you gotten any clue about what's causing the inability to phosphorate?
No. The question was, do we know the cause of the inability to phosphorylate? Why 15% of the population cannot stick a phosphorus mineral in their B complex? I don't know the answer to that, but I think it might be just genetics. I think that's probably the answer, but I'm not really sure, to be honest.
Who makes the 3BG?
That is a biotics research product. Okay? Yep.
Is that benfotiamine that's in that?
Pardon me?
Is it benfotiamine that's in there?
No.
No?
No. So the bile 3BG stands, it's a whole B complex, but the 3B means it's 3 times the amount of thiamine in there as riboflavin, okay? That's what that's about. This is basically, it's a B complex, but specifically supporting the thiamine metabolism. All right. Blood pressure is seriously elevated 7 of the year. This is obvious stuff. T2, more hard stuff. T2 level, same thing basically. The weird pain pattern here that perks me up and makes me wonder about this. Thenar pain. Shortness of breath, chest pain, throat, pain at the costal arch near the xiphoid. Excuse me. All of that is laid out right there on that chart. Nagging backache. This is the other interesting thing about it. When we back up one, see this that line on the spine from like T5 all the way down to the sacral apex? I'll have patients from time to time tell me, this thing right here on my back, doc, when they do that, they're telling me, fix my T2. The other thing is left thenar pain. That's a strange spot. My thumb hurts. I think I strained it. Maybe. Unusual pain patterns are the things when I pull up my charts and I'll show them to the patient. Mrs. Goldfarb of Invisky, I've got these are my pain charts here. I want you to look at them and tell me which one most accurately reflects you. And I'll lead through it. That's kind of what I'm hoping you guys will do with it. That's why I made these notes this way so that you could print out these pages, put them all together, T1 through T12. Once again, it depends on the symptoms. If the BP is within normal limits, these patients, many of them already know they have problems with their valves. You can try a few things. Cardio Plus from Standard Process. It's a beautiful little all-purpose cardiac support product. It will strengthen heart muscle and strengthen valves. This is another one of those moments where I will use Dr. Versendal's test in the office. It's a kind of a cool little test, and I think it has stood the test of time, and I confirm it using other applied kinesiology methodology. But a simple little test is interlock the fingers, hold your arms out like that, and see if Mr. Jones or Mrs. Scribumple can hold those arms up. If they fail, that usually to Dr. Versendal meant cardiac insufficiency, heart muscle struggling, needs nutritional products. Cardio Plus, Biocardiozyme Forte from Biotics Research will shut that down and make them better. Once again, Dan Shen is one of those all-purpose. If it doesn't respond to Biocardiozyme Forte and it doesn't respond to Cardio Plus, I'll pull out the Dan Shen and try that. And that red sage plant so many times. It's great for the heart. Great for the heart. Half the time these people know they've got valve problems, right? And they're on meds and stuff like that, but still, they're struggling and it's producing back pain patterns. T3. I'm not going to get to all of it. I'm going to start flying now, boy. So T3, bronchi and lungs. There's the weird pain pattern on this. Ring finger. Right? Left ring finger. My finger hurts, Doc. Just automatically ask, any breathing problems? Oh yeah. So many times. So I'll check T3, and I will check them for Allerplex, standard process, great little product. They've got history of allergies. Want some relief, Allerplex, Yerba Santa. There are so many ways that you can go, boys and girls, when they're talking about a viscerosomatic response and what you can do to improve the viscera. So many ways you can go. So these are the ways that I go that routinely yield clinical responses. Okay, so that's what I'm just sharing. There are many ways to go. But Yerba Santa combo, that's another pure herbs company. I used that one, I started using that one in the last 12 months because I could not get a hold of the next product, which is like my all-time favorite thing for bronchitis, pleurisy root. If I had a buck for every time I handed out pleurisy root for bronchitis and it cleared it in 48 hours, 72 max, be a rich, rich man. I'd order that by the caseload. And pure herbs, for whatever reason, couldn't get any pleurisy root for like 11 months. It's like, you're killing me here. So I went through their manuals looking for what are my options for lung and main stem bronchus, and I found this Yerba Santa combo product, so I ordered a few bottles of it. I'll try it. It worked well. So I started ordering that a dozen at a time. I burned through them in a week. At this time of the year, but even their mama comes in with main stem bronchus, right? So that is a great little all-purpose product, second only to pleurisy root. Pleurisy root for fixing main stem bronchial problems and congestion and mucus and all that stuff. That's a silver bullet that it works every time. Almost every single time. Pleurisy root. You can clear up their bronchitis for them with that. Beautiful. And finally, when the patient's really struggling and they're in trouble, I will give them this methyl donor called Organic 15 on Biotics. It moves methyl groups around in the body, cranking oxygen into that respiratory tree, clearing up free radical complexes and cutting inflammation. When they're a mess, and you can tell when they're a mess, I give them both, pleurisy root and this Organic 15. But 95% of the time, the pleurisy root gets it done. And so that's typically what you see with a T3 reflex. T4, gallbladder, occipital pain. Where's the weird pain pattern here? Well, we already know about the right thumb web, right? But the weird little pain pattern here is elbows. My elbows hurt, Doc. You think it's my neck? Maybe. Do a little palpation, a little pokage on the medial aspect of the elbow, just above the elbows. Right there. They'll often pull away. That tells you. Suboccipital headaches all the time. You're adjusting occiput, you're adjusting atlas, and that keeps coming back. I rub that thumb web. Rub the elbows, just above the elbows. And that might be your clue that it's gallbladder. occipital headaches, gallbladder. Headache over the right eye, gallbladder. Pulling pain. Doc, I got this thing here, like pulling pain from the xiphoid to McBurney's. Appendix just sits right there. And it's pulling, drawing, it just aches, Doc. I'm telling you, look at my gallbladder. We've discussed this already. T5, stomach, right between shoulder blades and stomach. Take 5 seconds. Take 5 seconds. Push on their stomach. Gastritis. Now, why? What do you do about the gastritis? Once again, boys and girls, like there's a million ways to go with a stomach problem, a belly problem, right? So I want to teach you the most basic, the simplest thing to give that patient some relief. Skipping that, you can read it later. That. This is number 1, Gastrozyme, from Biotics, 2 to 3 tablets. 2 to 3 tablets 3 times a day, just before the meals. You want that chlorophyll with some water, half a glass of water, opening up, calming the fire on that belly. This will fix and repair gastritis and an ulcer. Another way to dose it, when this patient is in misery, this is only when I do it, like they come in like this. I haven't started taking it like 2 at a